Okay, hello and welcome everyone to today's gathering. We are so excited to have you here with us to discuss this very important question up on our screen. How can our communities become healthier? Health is definitely on everyone's minds these days. It's on our minds all the time here at Sauk County Public Health. So we're gonna just dive right into our expectations for you all during this meeting today. Now, we would have loved to meet in person. We had planned to see you in person over the summer when we talked about doing this event. As you all know, it's not possible at this time for so many of us to gather in a place safely. So thank you for joining virtually. As you can see, this is being recorded. We would ask everyone to please mute yourself at this time. I do hear a little bit of feedback, so it'll be really important, especially for our recording, that you stay muted. And use the chat box, be chatty, please. It's our one way of interacting here in the Zoom environment. So please put in your comments, your feedback, your questions into that chat for everyone to see. Do that at any time. It will not distract me. I'm not going to pay too much attention to it while I'm presenting. We have Siobhan Allen of the Health Department who's going to be monitoring that for us. And basically what we'd like to hear from you all in the chat is, how well does what you're hearing fit with your experience of your community? Do you agree? Do you disagree? Do you think that the measures we're sharing are good ones, are bad ones to be looking at in terms of looking at health? And yeah, what's your experience? That's what we'd really like to hear from you all. Siobhan has already put a chat link into the chat for today's slide. So it's a PDF of all the slides we'll be covering. I know some people like to have that right away to make their own notes or to kind of know where we're at in the presentation. If you do look at it, don't be overwhelmed by the number of slides. It's a bunch, but we're going to go through them quickly. We have this all timed out so that we won't keep you for longer than an hour and a half. So here is our agenda today. We'll start by talking a little bit about what we did for our community health assessment, our survey and focus groups and key informant interviews. So we'll set the stage with that and then look at how healthy Sauk County is. What makes our communities healthy, which health factors are strong in our community, which need improvement. So for this, I have about 45 minutes of presentation, but we're going to seed throughout that little times, about 5 minutes each, where we can have some Q&A, some polling for you all to stay interactive with us, and some discussion. So we will have time for Q&A throughout that session, and we'll also devote some time at the end of the session for Q&A and comments. After that, which is the bulk of our presentation, we will spend a little bit of time on prioritizing what health focus areas we should work on in the next few years. So we have about 10 minutes dedicated to that, and that includes an individual survey that we'd like you all to take. It's very short. It's really only 2 questions about what would you like to see us prioritize in the next cycle. So our cycles are about 3 years long, and we want to hear from you directly on what 3 topics you think we should focus on. So keep that in mind as you're listening today, that that is your action item that you're going to need to tell us what you think is most important to the health of your community. And then at the very end, we'll just have some next steps and put all of this in context in the larger cycle of community health improvement. So first, I'd like to start us out with a definition of health. We're using the World Health Organization definition here, and it's a great time to introduce, isn't this dog just, to me, it epitomizes good health. It looks so happy, this little dog, here on a Baraboo sidewalk. And it's a good time to thank Uli Grunberg of the Grunberg Institute for all these great Sauk County photos you're going to see today. So health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. That's the working definition of health that I'd like you all to keep in mind as we progress through the presentation today. So how do we become healthier as a community? This is the model that we've adopted from the county health rankings. That is part of the UW Population Health Institute. And they have an awesome website. If you've never seen it, County Health Rankings is what you would Google. And this is their model for how a community becomes healthier, and it's what we use. You can see on the outside kind of the steps that envelop the whole process is working together and communicating as consistently as humanly possible. And right at the heart of it is you all, our community members and our community sectors that are all represented around that wheel right in the middle. So we have representing that wheel in the middle, Sauk County Data Council, which does envelop all of those different sectors here. So we have been very fortunate to meet with them for the last year, every month, to really work on this assessing needs and resources piece. But just to keep in mind that this whole cycle really has the community and you all at the heart, and we want you to be at the heart and really be the drivers of this whole process. So looking at that cycle, at the arrows there in yellow-orange, we are right here at about the 1 o'clock spot on the clock for assessing needs and resources. It's what we've worked on for the last year in this cycle. And it's what we're going to present on today, show you our findings. And then with you today, we're going to focus on what's important. We're going to prioritize which topics Sauk County should work on for the next few years. Then in action teams, we'll be choosing effective policies and programs to address those priority issues. We'll be acting on what's important and evaluating those actions. And that Sauk County Data Council will help with evaluating those actions as well, is our intention here. So what did we do to assess needs and resources? In the spring of this year, we did a survey. We were so thrilled to get robust survey response. We were worried in the pandemic that we wouldn't get as many survey respondents as in past cycles, because in the past we would go out in person to where people were gathering, like the Sauk County Fair, and have them take the survey right then and there. But the Data Council worked super hard to get these surveys out, and all of our community partners, they're not all represented on the bottom here, but Sauk County Public Health and our 3 area medical centers all have an obligation to do this process. Every 3 years, we choose to do it together in that cycle so that we can be really inclusive. And we were helped greatly by the Sauk County Data Council to get these surveys out. So the surveys were taken by about 3% of our county population, which was 64,000 people in 2019. In a moment, we'll talk about how representative those survey results are, but this is still our overview. So we did the survey, and then we did 11 key informant interviews, and those were conducted by the agencies you see at the bottom of the screen there, 11 focus groups, and then we compiled secondary data. A lot of the data I'll be sharing with you today is from the county health rankings, but we also have other sources like our census, statistics from a variety of sources. So just how representative was our survey? It does overrepresent people who are female. So men were definitely underrepresented. It overrepresents people who are middle-aged. We really didn't get very many young people to take the survey, meaning people under age 24. People who are married are overrepresented, and homeowners with a mortgage were also overrepresented. So not as many renters as we wanted to get to take the survey did so. Our survey also overrepresents people who are well educated. Nearly half of the people who took our survey had a bachelor's degree or higher. So people without a high school degree or whose highest level of educational attainment was a high school degree are definitely underrepresented here. Non-Hispanics were overrepresented. So we did have a Spanish version of the survey and cards that promoted the survey in Spanish, but we still didn't get as many Latinos as we would have hoped to be more representational of that population group. Fairly accurately represented on our survey is white non-Hispanic, African American, Native American, disabled, separated, divorced, or widowed. And we also fairly accurately represented employed. 60% of Sauk County residents are employed full-time. That's of working age, of course. And then median household income, we think we're kind of in the ballpark there. $59,000 a year is our median household income. And on the survey, our median bracket was 51 to 75,000. Likely, our survey is skewing a bit towards higher income, especially with that higher level of educational attainment, which is very highly correlated with higher incomes. So what we did, we found out who was taking our survey in March, April, May, and we said, okay, how do we balance who's taking the survey with who isn't taking the survey in our focus groups and key informant interviews. So we decided to over-represent in those groups people who were not as accurately represented on the survey. So we really reached out, and by we, I mean public health and our area medical centers really worked so hard to hear from groups that maybe weren't as well represented on our survey. And when they talked to those people in our interviews and focus groups, we had three main questions. It was, what makes a community healthy in general? Thinking about your community, what would make it a healthier place? And last, what strengths can we build on to make your community healthier? So you're going to see throughout the presentation today kind of the priorities that arose from those interviews and focus groups, kind of what rose to the topic, what rose to the top in terms of topics for health that we should improve on. And just a word here that we are not going to focus on COVID today. I know COVID and health are like in 2021, what is on everybody's mind, but we are really looking at the big picture of health and health trends over time, meaning over a decade, over several years, not at so much at specific years. But our surveys and focus groups, key informant interviews were conducted in 2021, so right in the middle of the pandemic. So they are a snapshot of our health at that time and our perceptions about health during that time. But our main secondary data sources, like from the county health rankings, are all mostly from pre-COVID times. So I just want to let you all know that we won't have a lot on COVID here. Are there any questions or comments before we dive into our main topic today, which is how healthy is Sauk County? Anything from the chat?
There's nothing in the chat yet, Sarah. So a reminder, please feel free to use the chat to share any of your questions or comments or thoughts as we go along.
Thanks, Siobhan. Awesome. We will head right into then. How healthy is Sauk County? And this photo is thanks to Siobhan. Again, I guess it's just my personal preference, like animals and health. So the asterisk is here to remind me to say that surrounding areas, what surrounds Sauk County, it was also included in our survey and focus group results. So our healthcare systems do cover areas, of course, outside of the strict boundaries of Sauk County. And we as a health department also serve people who are visiting here and others from surrounding counties, especially, for example, in our COVID vaccine clinics, which is where quite a few people took the survey. So our secondary data does focus on Sauk County, but our primary data that we collected this year includes some surrounding areas as well. So looking at how healthy we are, we're using the county health rankings model, and their health outcomes are length of life and quality of life. And you can see what factors they include in each of those topics. So we rank 30th best out of 72 counties for length of life and 31st best for quality of life. So we are above average in these regards. Mental health does lag behind physical health in all areas, but more so in Sauk County. So what we're looking at here is the average number of poor health days in the past month, and that is age adjusted. So poor physical health days, you can see Sauk County here in the green is slightly worse than Wisconsin as a whole. And slightly worse also than top US performers. So what that category is on county health rankings is these are counties in the US that perform better than 90% of other counties in the US. So you see here poor mental health days are more than poor physical health days, and kind of a bigger disparity there for Sauk County compared to the state. So what makes our community healthy? Here is a model that we use, again, from county health rankings and roadmaps. So you see length of life up at the top and quality of life. Those are our health outcomes. And what contributes to that? This is the model. It says 30% of that is due to health behaviors like tobacco use, diet and exercise, alcohol and other drug use, sexual activity. 20% due to clinical care, that's access and quality of care. 40% for social and economic factors. So this is education, employment, income, family and social support, and community safety. And then 10% from the physical environment, our air and water quality, and housing and transit. So to get you kind of comfortable with this model, if it's the first time you're seeing it, or maybe you've seen it lots of times, I'd like to know what you think. Which areas do you think Sauk County excels in? Health behaviors, clinical care, social and economic factors, or physical environment? So we have a poll for you now that Jody will bring up here. And we'd like to know, compared to other Wisconsin counties, in which set of health factors does Sauk County do best? So we'll give you a moment to complete this poll. And if you have any questions at this point too, great time to check that chat box for anything that might have come up so far. All right, people are still taking that poll. All right, looks like we've slowed down here. And the answer here might surprise you. So most of us think we don't do so hot on health behaviors. Clinical care is coming in at #1 here. That 58% of you who took the poll think that's where we excel. And actually, you are wrong. That is, according to our health rankings model and the data, indicators that they choose, that's where we do the least well. And I found that really surprising. I think of our quality of care as being excellent here. Now, you all might argue and say you don't like which indicators the county health rankings pulls out, and I can totally welcome that discussion. But yeah, that one was our worst performing indicator. Our best performing one, we can stop sharing that now, is, drum roll please, social and economic factors. Can you believe it? This was, you all didn't think so either, and I wouldn't have voted for it either. But according to
that makes me very happy though.
Well, sweet. Yeah, and we'll take a look at what factors the county health rankings chose to look at here. And I do have to say, it is tough, the work that county health rankings does, to put together a model like this that is consistent with data and statistics and our best understanding of health. And it's also hard because they need indicators that are available on a national level and a county level easily, and that are reliable. So they might not include the indicators that we'd always like to see, because we know, we might just have a different feeling for this, being residents and people who work and live here too. So social and economic factors, we're going to start with these today. And this does have the biggest impact on health. 40% of health outcomes are determined by these factors. And these are education, employment, income, family and social supports, and community safety. So these factors significantly affect how well we live and how long we live. They're the largest influencers of health, and it's where we do best in Sauk County. We are 26th best in this category out of 72 counties. So social and economic factors affect our ability to make healthy choices, afford medical care and housing, manage stress, and more than that. They really affect all the factors that we're going to discuss today. And I need to tell you too, so this is our biggest category. This is going to be the area that we spend the most time on. And I don't want you to start worrying that we're going to spend an equal amount of time on each of the other categories. Those will be shorter. So we're going to tackle the thorniest issues first here today. So starting with education. So a lot to unpack on this slide. I'll walk you through it, but at 91%, Sauk County's high school graduation rate is very good. And you see it there right in the middle in that bright green color. This is the Sauk County average of 9th graders who graduate high school in 4 years. But it is significantly lower for economically disadvantaged students. Only 86%, that's all the way at the bottom here, of economically disadvantaged students in Sauk County graduate in 4 years. 94% of Sauk County not economically disadvantaged students graduate in that time. And that is right up there with, US top performers on average. So our 91% rate is slightly better than Wisconsin, but we wanted to dig into this data a little more and got that from the Department of Public Instruction. So about half, 45% of Sauk County students are economically disadvantaged. And we also thought it was important to note here that those students who are economically disadvantaged also receive disciplinary action like suspensions at much higher rates than their non-economically disadvantaged peers. So this is definitely something we could work on as a community. Looking at our poverty rate in Sauk County, it is very strongly tied to education level, not surprising here. So the green that you see right in the middle of the screen is our 10% poverty rate. But for people with less than a high school degree, that nearly doubles to 19%. And then you see that the rate of poverty decreases the more education you have, all the way down to 3.4% of those with a bachelor's degree or higher in Sauk County experience poverty in the last year. Looking at employment and income next. Employment in Sauk County is comparable to the state. It was 3% in 2019. And then 4% in July of this year. So it definitely went up during the pandemic, but it has gone back down. This is just people who are unemployed and seeking employment. However, total unemployment, which would include the unemployed, discouraged unemployed, meaning they're not looking for employment anymore, and underemployed is 9% in Wisconsin. So we would estimate that to be about 3,000 Sauk County residents, so quite a few people. And then we also have 2,000 Sauk County residents who are defined as working poor. They are employed, but their income is below the poverty level. Here we're going to take a look at median hourly wage. That corresponds well with what I just shared about working and still poor. So our median hourly wage of $18.12 an hour is not enough to support families with one child unless 2 adults are working full-time. So here, that living wage of $18.12 that's our median wage, but living wage shown below with the columns or bars of data here is the hourly rate that's needed to support the household. So if you are a single adult in your household, you need to make $14.15 an hour. If you are 2 adults and 1 child and both adults are working, you need to make $15.70 an hour each on average. So those don't work out, or those are the only ones, that do work out those family sizes. So if you have a larger family, like 1 adult, 1 child, single parent household, or you have 2 adults and 1 child, but only 1 adult is working, you need a lot more than Sauk County's median wage. Now, this was corroborated with our survey results. We asked on our survey we had a number of statements and asked people to indicate how strongly they agreed with each. So the statement, "My community has enough jobs that pay a living wage," scored a 2.8 out of 5 on our survey. And this is where 1 equals I strongly disagree with that statement and 5 equals strongly agree. And this was our second lowest indicator after my community has enough safe and affordable housing. So we know that living wage is a big deal here. Our higher child poverty rate is also concerning. Child poverty has grown in our area from 9% in 2002 to 15% in Sauk County in 2019. So it is slightly higher than Wisconsin, certainly higher than top US counties. Our percent of children in single parent households, which is often quite closely correlated with poverty, is lower than in Wisconsin, but certainly not as low as it could be. Again, Sauk County's overall poverty rate is 10%, but this includes significant disparities by race and ethnicity, which you can see here. This is the percentage of people that are in each race or ethnic category experiencing poverty. And it goes from 4% all the way up to 25%. So 1 in 4 people of 2 or more races in Sauk County are living in poverty. So quite high there. All right, the third of our 4 topics under social and economic factors is family and social supports. Aren't these kids just so adorable? Oh my goodness. So we'll explore a few different indicators here because this is kind of a big topic. And we'll start with the results of our survey. And I do want to say you might not remember taking our survey. I hope you did, but we asked a lot of questions on social and economic factors on the survey. It was kind of the #1 topic covered in our survey because it was the one that we needed more data on than we could get from other sources. So again, on the survey, we asked people to indicate their level of agreement with a number of statements, and social connection showed very high levels of satisfaction with most of the indicators. So the one that received the lowest score here, and this was 3rd lowest on our survey. So #1 lowest was affordable housing. #2 lowest was the living wage statement. And then #3 was decisions are made with resident participation. That is, leaders listen to resident concerns and take appropriate action. So people felt that was not happening as much as they would like to see it happening in Sauk County. That's definitely something we could work on. We kind of call that social connectedness loosely there. But then you see high quality education, opportunities to gather for people like me, feeling accepted, getting along with neighbors, and our communities being good places to raise kids. So we all know when family support of children is not strong, when there's adversity in the home, that this can produce what we like to call toxic stress in the developing brain. And this can result in a whole host of health problems later in life, which we're going to look at in just a moment. So early research on ACEs, or adverse childhood experiences, was conducted back in the 1980s. I can't believe it's been nearly 40 years since that research was first published, and it included 10 different factors or experiences of adversity that children under the age of 18 might experience, and that would lead to worse health outcomes for them. So you see them listed here. They go from maternal depression, mental illness, emotional and sexual abuse, substance misuse in the family, domestic violence, homelessness, incarceration, divorce, physical and emotional neglect. So those were the 10 ACEs defined in that early research, and we're still using those today. 12% of Sauk County residents had 4 or more of these ACEs before age 14. This is slightly lower than the Wisconsin rate of 16, or actually substantially lower, 12%. And I should note too that this is very dose dependent, we would say. So the more of these negative childhood experiences you have, the more likely you are to experience negative health outcomes for physical health, mental health, opportunities to excel, economically, etc. Now, as our understanding of adverse childhood experiences and toxic stress has grown over the last 40 or so years, we have added on adverse community environments that also create the same level of toxic stress or a similar level of toxic stress. If you're growing up in poverty with discrimination, with a lot of disruption in the community, lack of opportunity, quality and affordable housing that's not available, a violent community, this also can have that effect of creating toxic stress, especially in that developing brain. So we don't have as much research on that because it is kind of a more new and emerging science, but you can really think about how they impact our community health quite easily. And now we're kind of unpacking that all today in this section. So these adverse childhood experiences or adult or adverse community environments can lead to so many problems, as you see here on the screen, from higher rates of injury to mental health issues, maternal health issues, infectious disease, chronic disease, risky behaviors, and decreased amount of opportunities in education, occupation, and income that are available to people. So without developing resiliency skills, parents who have a high ACE score will pass along their dysfunctional behaviors, their coping mechanisms for dealing with that stress to their children, who then they in turn grow up with a high ACE score. And this makes for a generational health issue that's at the root of so many of the health factors that we're looking at today. So one person's trauma can really affect generations. And you can think about that, you know, again, not just for the family, but at the community level. Think about historical trauma here in Sauk County caused by discrimination, for example. Think about our Ho-Chunk community that had lost their land, had forced boarding, you know, boarding schools, sorry, and, you know, forced migration and how that effect can ripple through generations. Same with discrimination. So for other groups of people as well. So we might think about like, well, you know, the civil rights movement was in the 1960s. The boarding schools ended, I believe it was in the 1940s, I want to say. I might be wrong on that. But, you know, it was a while ago, but the impact of that ripples on through the generations. If you're interested in this topic, there are lots of websites for you to check out. You can let us know in the chat. We're going to turn next to that very topic of discrimination. Looking to the county health rankings model, they have a residential segregation index. So here in Sauk County, our residential segregation is much better than Wisconsin. You can see Wisconsin's is pretty bad, but we are much worse than those top US counties that we can try to emulate. So here, a higher index value indicates greater residential segregation. So you want a lower number here. And county health rankings gives us information on non-white residents and white residents and Black and white. And you can see the difference between Black-white segregation there is a lot greater for all those three levels of top counties, Wisconsin and Sauk County. We asked a question as well on discrimination in our survey. We asked if the survey respondent or someone in their household experienced discrimination in their community. And 3 out of 4 Sauk County survey respondents of color said they always, usually, or sometimes experience discrimination in the community. This is compared to 1 out of 10 white residents who took the survey and 1 out of 4 non-heterosexual respondents. So this is a big problem. Here we're defining respondents of color as being anyone non-white and non-Latino. So people of color here would include African-American, Native American, Latino, Asian, Middle Eastern, 2 or more races, etc. We dug in a bit more on the survey and asked about what types of discrimination were experienced by Sauk County residents. The most popular type indicated was by income or social economic status, people feeling discriminated against because of that. Second, and closely following it, was race and ethnicity, followed by gender, skin color, sexual orientation, disability status, age, and then fewer people experiencing criminal justice history, place of birth, and citizenship status discrimination. We asked where people in our community were experiencing discrimination, and the top was public places like parks and streets, closely followed by when shopping or dining, and then at work, at school, and the other indicators were far fewer, with neighbors applying for a job, with other government officials, not police, with law enforcement when seeking housing, in a place of worship, or in their own home. All right, moving along then to our fourth and final topic under social and economic factors, community safety. And we just have one slide for you here. I know this is a lot to digest quickly. So thankfully, most residents in Sauk County feel safe, and the police help them to feel safe. This again was from our survey. So to summarize what you've heard so far about social and economic factors, these are the topics that we've identified as in need of improvement. So they're listed here on the left. And then in each column, we have some factors for you to consider, like, was this voiced by the community as a top priority in those focus groups and key informant interviews? Are we in Sauk County worse than the state on this measure? Are we getting worse over time? And for some of this, we don't know. So if it's blank, it might not mean definitely a no. And then where are our inequities on these topics? Who is experiencing this problem more? And you can see here, this is kind of an interesting section because income in the form of living wage is a topic, and it's also an inequity, as well as a high ACE score is a topic here, and also definitely an inequity because people with high ACE scores, for example, don't have that educational attainment level as high as their counterparts without a high ACE score. So at this point, we're going to ask for your opinion again on a poll. What do you think we should work on in this topic area of social and economic factors? And we have here some criteria for choosing for you to consider. We're going to look at this throughout the presentation, so you'll get real used to this slide. So when thinking about, what should we prioritize, you could think about magnitude, how many people are affected, how bad is it? Is it getting better or worse over time? You can think about comparisons. How do we compare to the state, other similar counties? You can also think about how ready we are as a community to take on this topic. Is it possible for us to achieve success with it? And then disparities. Are some groups impacted more, and therefore we should focus more on this topic? So Jody, if you could pull up the poll for our social and economic factors, and you can see what choices you have. They will correspond to these here.
I'm attempting to, Sarah, but it's giving me a fail code.
Huh. Did the other has the other poll been closed out? Is that potentially why?
Well, it says it's ended.
Okay. We'll let you grapple with that for a moment. So I know there was a lot in this section. I know I moved through it rather quickly because there is so much to cover today. But feedback, is this jiving with what you feel and experience in our community? Any surprises for you here? Anything you'd like to comment on in terms of what you think should be a higher priority? And Jody, I guess if we can't take that poll, we could vote in the chat because we will save the chat history.
Okay, yeah, I'm sorry. It's giving me an error.
Okay, well, we'll let you work on that in the next section, hopefully work that out. And why don't we vote then in the chat? For this one, I was going to say you can choose 2 topics that you think we should focus on. Or maybe you think none of these should be focused on as a top priority in the next few years because you'd rather save your vote, so to speak, for another topic that we'll cover today. but or you can feel free to put in the chat something else that, you know, isn't here, but is a social and economic factor that we haven't considered, that's maybe not part of that county health rankings model. So use the chat, everybody, since our poll is not working out for us at the moment. And Siobhan, anything? Oh, look at that. Nope, that's the old one. So maybe Jody, there we go. Let's see. Yes. Oh, Jody, you did it. Thank you. So here we do ask that you choose 2 only. It will let you choose more than 2, but please be fair and only choose 2, because otherwise we'll have to negate your results when we download this. And I'm gonna put on this slide so you all can consider that criteria as you're choosing.
And as people are choosing, we're getting a couple other comments in the chat. So for those of you who are on the phones and can't see the chat, some of the additional priority areas that are being listed is affordable housing and sober living housing as well.
Beautiful. And I should have mentioned that, you know, housing really does fit in this category well, but for the county health rankings model, which we're following today, that is under physical environment is housing. So you can definitely have an opportunity later today to prioritize affordable housing, and love that comment about sober living housing. That is definitely a concern in our area. So it looks like our poll results have kind of firmed up here. It looks like poverty is a main topic, followed by ACEs, high ACEs. But it looks like we care about all of these issues a great deal. All right, so we'll move on from there then. Jody, if you'd like to end that poll. Our next topic is health behaviors. So these are actions that individuals take that really affect their health. They include things that lead to improved health, such as eating well and being physically active. And they also include actions that increase your risk for disease, like smoking, excessive alcohol use, and risky sexual behavior. Jody, I'm still seeing that up on the screen. Is everyone else, or is that just me and I had to get rid of it myself? Are we good? Thumbs up from me? Okay.
We're good.
All right, sweet. I'm gonna move ahead then. So health behaviors here. So healthy behaviors account for 30% of health outcomes, according to this model. And Sauk is 30th best out of 72 counties. So again, we're in that above average category. So we're going to start with the use of alcohol, tobacco, and other drugs. Our use in Sauk County is much higher on these with these substances than in Wisconsin, and is generally much higher than in top US counties. And this is where I am so grateful that we can compare ourselves to the US and not just Wisconsin, because Wisconsin has a big drinking problem. And so if we look at, for example, excessive drinking and alcohol impaired driving deaths right in the middle here, you might think, oh, Sauk County is not that bad. Only 28% of adults are binge or heavy drinkers. That is terrible. 28% is super high, y'all. Now in Wisconsin, it's 27%. So you might start to pat yourself on the back and say, you know, we're not that bad. But look at top US counties, 15%. So we really have a lot of work to do in this area. Same with alcohol impaired driving deaths. You see that percentage, 36%, super high for Wisconsin. Better in Sauk County at 29%, but top US counties is 11%. Drug overdose deaths are also, this is a rate per 100,000 residents, and Wisconsin is also high for that, and Sauk County a bit higher than the state average there as well. With the percent of adults who smoke, we are higher than state and top US performers, but a little more in line with that than we are for the other indicators of drug use. Next, we're going to look at eating well, physical activity, and obesity. So our food environment in Sauk County, we rank right up there with the top US performing counties. Wisconsin as a whole does as well. So these are the indicators from county health rankings, the percent of people with limited access to healthy food. We are ranked there, we're given 2% is the indicator. So that's right in line with top US performers. So we perform better than 90% of other US counties and better than Wisconsin as a whole. For percent food insecure, we are also better than Wisconsin as a whole and better than 90% of other counties. So we might be in like that 95, we're better than 95% of other US counties there. And then County Health Rankings uses a food environment index, and here a higher number is better. So again, we are better than that top 10% of US counties there. But we do know that getting healthy food is still a struggle for many people in Sauk County. Just 4% of our survey respondents, which wasn't a lot, 67 people, could get healthy food to eat only, sometimes rarely or never. I think this probably speaks more to who we got to take the survey versus, a really accurate picture of food insecurity in Wisconsin, because we know, especially in this last year during the pandemic, that food insecurity went up quite a lot, especially in 2020. I think our food programs have really stepped up to help. And of course, the federal government has as well, with increasing benefits for people who are food insecure. But we do have this issue in our community. When we asked survey respondents why it was hard for their family to get food, expense was by far the top reason for that challenge. Healthy food is expensive. Adults in Sauk County are more obese, but we are also more physically active than Wisconsin here. Obesity has been increasing since at least 2004 in Sauk County, Wisconsin, and the US. So we see here 35% of adults are obese in Sauk County compared to 32% in Wisconsin. So the percent physically inactive, so these are adults who did no leisure time physical activity in the last month, and that was 18% in Sauk County, which is actually better than that top tier of top US performers. So that kind of speaks to where we are as a nation with this. I was surprised when I read about that indicator. It's like nothing in the last month. Like, that's a little scary how high that is. And sexual health. I'm sure you're all laughing at my image choice here. I really couldn't find a good one. So we are comparable to the state. Here you see the number of newly diagnosed chlamydia cases per 100,000 population. This has been rising steadily again in the county, state, and nation since at least 2007. Back in 2007, Sauk had a rate of 184 cases per 100,000 population, and that has more than doubled to 402 for this indicator. And that is better than Wisconsin, but certainly not good. Our teen birth rate is in line with the state as well. And so that sums up health behaviors. So in need of improvement here, we have substance use. We pulled out separately healthy eating, obesity, and physical activity, but we definitely acknowledge how interrelated all of those are. And then sexual health and what kind of inequities we're seeing, what's getting worse, where are we worse than the state, and what was voiced by the community as a priority. So Jody, you are on it. You got these polls now. We're going to ask you again to vote using the same kind of criteria: magnitude, severity, time trend, comparisons, community readiness, and disparities. And again, you can vote for none of these if you think we shouldn't focus on anything in this area to work on in the next few years, or another health behavior that hasn't been identified here. And right now, are there any comments, questions in the chat?
There's not anything new in the chat. And then just as a reminder, I have put in the link to these slides. So there's a PDF available for you to have after this presentation.
Thanks, Siobhan. Looks like the results are in, and substance use is a clear front runner. 65% of you think this should be a top priority, followed by obesity. Okay, well, thank you for that. We're gonna move on then to clinical care. So this accounts for 20% of health, and Sauk here is 51st best of our 72 counties. What is clinical care? It is access to affordable, quality, and timely healthcare, and this can help prevent diseases and detect issues sooner, enabling us to live longer and healthier lives. So although we sometimes focus heavily on clinical care when we think about health, it's part of a much larger context for health, as you've already seen today. So it does account for 1/5 of health outcomes. All right, so access, not a surprise, I bet, to anyone on the call today, but Sauk County needs more dentists and more mental health care providers. So what you're seeing here is the number of residents per provider. You see at the bottom, primary care physicians are plentiful. So here a smaller number is better because it's how many people per provider. So here we're doing well. Mental health providers right in the middle there, you see that we're not doing as well, 590 people per provider. And then dentists also 1,500 people per dental care provider. Our ratio of people per dentist has improved. That means it's smaller than in 2012, so we are improving there. On our survey, we asked if people in the household could get the health services they need, and 12% said that they could get these health services only sometimes, rarely, or never. When we asked what kind of health services were challenging to obtain, dental was number one. We're not surprised by that because it's really difficult in our area if you have Medicaid to find a dental care provider that takes that insurance. Mental health care providers were next, followed by physical health and then substance use related. Why is it challenging? The top reasons were expense. Expense by far was the top challenge, I should say. 30% of people said that was a big influencer and why it was hard for them to get healthcare. Wait lists, services not available in our area, and insurance. And by insurance here, I mean either the provider doesn't accept the insurance or they don't have insurance. Moving next to prevention of chronic disease. So here, chronic diseases are defined pretty broadly as conditions that last a year or more and that require ongoing medical attention, or they limit your activities for daily life, or both. So chronic diseases are things like heart disease, cancer, diabetes. These are the leading causes of death and disability in the United States. So what we're looking at here is in preventing chronic disease, we are lagging behind in mammography screenings and flu vaccinations. And the indicator that, that County Health Rankings uses here are the indicators we have at the bottom here, the percent of Medicare enrollees that are vaccinated for flu. And you can see Sauk County in green being lower than the state and top performers. And then percentage of female Medicare enrollees with an annual mammography, also lower here. So when I said at the beginning, we think our clinical care is real good, but we're ranking lower, it's because these were the indicators that were chosen. In part, yeah, it's due to the indicators that were chosen. There might be other indicators that would show that we're doing better here, but I'm not sure what they are. And if you're working in the healthcare industry and would like to share out on this in the chat, we'd love to hear from you. Also included here is uninsured, and that is a positive note that our uninsured rate is low and has improved since 2012. So 7% uninsured according to the county health rankings. A little bit more on prevention of chronic disease. We do have in Sauk County more preventable hospital stays. So this is not good. This rate has improved since 2012, but you can see here Sauk County's rate of preventable hospital stays per 100,000 Medicare enrollees. So these are our hospital stays for ambulatory care, sensitive conditions. So Yeah, that's what we're looking at. So to summarize clinical care and what's in need of improvement, we have access to mental health care, dental care, and chronic disease prevention. What was voiced this year in those community health conversations, where we're worse than the state is in all three. What's getting worse, mammography and flu vaccine rates, and then inequities. So Jody, if you'd like to pull up that one, which you already have, you're awesome. Again, you can think about the same criteria here. Which factors should we focus our efforts on? And you can choose just one, thinking about this, or you can say none of these, or you could give us something else. And Siobhan, do we have anything in the chat related to this section or anything we've previously covered?
So in the chat, we have a couple comments on more providers accepting Badger Care or Medicaid.
Yeah, for dental and for mental health and substance use. Or do we have specific feedback on any of those?
Not specific feedback, but it came up on that slide where the dental access and mental health access was being discussed. So if Nicole, if you could in the chat, if you want to expand on the particular services, that would be great.
Awesome. And I see here the results of the poll, mental health care far and away is a top priority. That is what we heard a lot from residents as well. Okay. We are good to end that poll, Jody, if you haven't already. You all are doing awesome. We're making really good time here. We just have one more health factor to consider, and that is our physical environment. And it's just a few issues, although they're biggies. So the physical environment is where we all live, learn, work, and play. People interact with their physical environment through the air we breathe, the water we drink, the houses we live in, and the transportation that we access to travel to work and school and fun activities. So if we have a poor physical environment, it can really affect our ability and that of our families and neighbors to live long and happy lives, and healthy ones too. So physical environment accounts for 10% of health outcomes in the county health rankings model, and Sauk is 33rd best out of 72 counties. So again, in that above average space. So air and water quality, doesn't that just make you want to run to Devil's Lake right now? Our air quality is good. Our water quality is as well. So what you're looking at here is average daily density of fine particulate matter. And I spelled matter wrong, sorry, in micrograms per cubic meter. So this measure has improved from 11 in 2002 to about 7 in this year, which was 2016. We're looking at the data from there. So very close to the state. We have excellent air quality here, thank goodness. And in addition, we had no drinking water violations in 2019. So more complicated, thorny issue is housing, which has already come up in the chat, thankfully. I'm glad you guys are on it for housing. So our housing measures are comparable to the state, which doesn't mean that they're great. So here we're looking at first the percent of people with a severe housing cost burden. And this means that 11% of Sauk County residents spend 50% or more of their household income on housing. So that is better than Wisconsin's rate, not as good as top US performers, but kind of alarming that that many people in our communities spend over half their income on housing, or half or more. Next, we're looking at severe housing problems. So 14% of Sauk County residents have at least one of these 4 housing problems: overcrowding, high housing cost, lack of kitchen facilities, or lack of plumbing facilities. And then the last indicator we have here is the percent of home ownership, which we are doing better than Wisconsin at here at 69%. We wanted to dig in a little bit more here on that high cost of housing. and share that 28% of Sauk County households spend 30% or more of their income on housing. So that's over 7,000 households in Sauk County. And households that rent are much more likely to have a high housing cost burden. 45% of Sauk County renters spend 30% or more of their income on housing. So this leads us right back to what I've shared now a few times, that on our survey, the worst performing indicator was my community has enough safe and affordable housing. Looking next at transportation. In Sauk County, driving alone on a long commute and household broadband access are similar to state rates. They kind of lump those together. I guess I know why. You know, if you have good internet, you don't have to leave and commute as much, maybe. So here you can see we are quite similar to Wisconsin on those measures. In our survey, 96% of our survey respondents always or usually have transportation to meet their household daily needs. So again, you know, we got an overrepresentation of people who are well-educated, higher likely income, more married, more people with a mortgage and homeowners. So I guess we expect to see this, but we all know working with clients that a lot of people struggle to get the transportation that they need and that we don't have a lot of services available. Transportation on our survey did seem to be more of a barrier for accessing healthy food. So 4% of those with access challenges cited transportation as a reason, than in accessing healthcare. So only 2% of survey respondents said that was why they were having trouble accessing healthcare. So that likely speaks to the different services that we have available for people to get them transported to healthcare appointments, or it could speak to the central location of those various healthcare facilities that we're so fortunate to have here in Sauk County. That was the last indicator I'm going to share. So here's physical environment in need of improvement. We have affordable housing and transportation access. And we have our last poll of the day for you to take and let us know what you think about those topics. Should we focus on one? Which one above the other? Should we focus on none of these and spend our time on other factors? Or is there something else in the physical environment that you think is important to get on our radar now?
And while we're doing that, we've got another comment in the chat. So asking if there's thoughts on data for transportation to get to work and if people can meet that need and access transportation for that purpose.
That is a great question. And, you know, I feel that transportation data is really lacking. It's hard. I know the census does track, you know, do you have, what's the question, Siobhan? Do you know it off the top of your head? It's like, do you have reliable transportation? Something along those lines, or do you own a vehicle?
There's a little bit of census data on that, but not so much that's specific for work purposes. So it's pretty similar to our survey question of, do you have transportation to meet your daily needs?
Yeah, it's a tough one. And we would really welcome, you know, collaborating together to get more information on transportation issues and how we could address those in Sauk County, because we just keep hearing about them, but we don't have good hard data. And when we do surveys of the general population, they generally don't get out to people with transportation issues. And you can see why. If you're not out and about so much, you might not be learning about the survey or in places that would encourage you to take it. So certainly we see affordable housing above and away a top priority for you all. Thank you for sharing that. Transportation still an issue, with 1 in 5 of you thinking that we should work on that as well. So thank you for taking that last poll. And now, with all that you have learned, which I know is a lot, I know I keep apologizing for rushing through these. I kept wanting to pause, and maybe I should have more for you to take in all this information. I do suggest that you download the slides and, you know, kind of let it sink in a little bit more. I was concerned we wouldn't have enough time, but we are doing very well on time at this point. So moving into focusing on what's important. I'll share the slide that puts all of those different topics that were identified as in need of improvement on one slide so that you can sit with them for a moment, and we'll see any comments, feedback, anything surprise you today, anything irritate you today, anything you don't like about the county health rankings model, you know, that we chose to use today, or any indicators you think that we're missing when we're looking at health in this broad way. Anything that you would like to add to this list, and throw it out there, because now is the time to voice that opinion, so that when we ask you next to take a survey, you will feel equipped to do so. And I see that, Ken, you have your hand up. Go ahead and unmute and share, please.
Yeah, thanks, Sarah. So I know that the county health rankings, they have a little trouble addressing a thing that our coalition has been talking about, that I'm trying to get my finger on, which is sort of, you know, we've talked about isolation for a variety of reasons, whether it's geographic isolation or lack of social networks or family networks. And, you know, when we get into conversations with people, it's really disheartening to hear that there are people whose quality of life could be improved, but they're not able to do anything about it. And I feel like there's an opportunity there that I can't quite tell that the county health rankings are particularly good at. So I just kind of throw that one out there, because although that's not in our qualitative follow-ups to our focus groups, we did a small survey. The isolation issue does not like rise to the top. It's still there, and I still wonder about the people who are just unable to connect with others. So maybe it's not isolation so much as it's what you talked about earlier with community connectedness. So that's just sort of something that I'm trying to keep my eye on as we go forward.
Yeah, thank you so much, Ken. You did a great job of fleshing that out. And I agree that the county health rankings really doesn't shine in that area. I think, again, it's very hard to find indicators for the kind of the soft feeling of connectedness. And it's not just a feeling, it's a physical, definitely a physical thing as well. So one indicator that county health rankings does include that I didn't even think was so worth sharing today was like, how many groups are you a part of? Like group affiliations, you know, which I think is an odd way of counting social connectedness. Yeah, it's odd. I think it's really hard to do proper research on.
Yeah. Well, Sarah, if I could just quickly add one other point about that. The reason from a hospital healthcare system representative, the reason that this is very important is that if we don't check in on people whose health or mental health is failing, we find out about it too late, and that puts undue burden on law enforcement, EMS, as well as the healthcare system. So I continually look for ways to keep people out of the system, so that we can get in front of problems. And I guess when I think about it from my professional standpoint, that's the downstream problem with people we can't connect with. Some of that is pandemic related, I realize, but that problem has been around for years. And so that I just wanted to sort of explain, kind of where I'm coming from on that.
I appreciate that, absolutely. And we do have listed here social disconnection. So if you agree here with what you're hearing from Ken, that this is something we should prioritize, that's certainly one that you can vote on. It was a little hard, in putting this presentation together, that certainly would go under the social and economic factors. And we looked at a number of those. Yeah, it's a tough one, but it would be one that we would welcome diving into more and learning more about. And I think it also touches on so much, like you said, Ken, it touches on preventative care. If you're not well connected, you're not going to see an issue before it becomes a very big one for you. And that could be prevention of a whole host of issues, not just chronic disease, but mental health, substance use needs, et cetera. So.
There's some additional input on that in
Great.
the chat. So there's a comment here that social connection is often a buffer between neighborhood conditions and individual behaviors, and these added resources are really important. And then an additional comment in the chat about the ADRC's aging plan, and some of the top topics of concern were transportation, home care services, finances, and then they also heard a lot about social isolation and broadband access.
Thanks. Yeah, absolutely. I like what I heard, like that social connection is a way of building resilience, you know, especially we have on here high ACEs. If you're experiencing adversity in your family, where else can you turn for building resiliency skills and building your resilience in general? Or if your neighborhood is feeling unsafe to you for whatever reason, you have those adverse community environments, where else can you get support? So I can see those kind of being hand in hand as well. Like, how do we either work on high ACEs or work on building resiliency in our community? Any other comments we should consider now? Or, you know, we've asked you to be muted, but as we did with Ken, we're happy to have you unmute and speak if you'd like. If we were in person, I would make you get into breakout groups and talk to each other. But we're not going to do that today, since we don't have a whole lot of time left. And we found those groups to sometimes be awkward in this virtual environment. So we'll move on then and ask you to please take our 2-question survey now. I say the link is in the chat. Is the link in the chat? I should put it there if it's not. Let me go ahead and grab it. I don't think I put it in there yet. I meant to do that. So let me explain what this survey is. I'm going to share this with everyone. Okay, there we go. So what the survey is, it's very short. It's really only 2 questions. So the first question is, what are your top 3 priorities? And we really want you to choose 3 only. And when I say that, we're looking at these categories, or you could add your own if you'd like. So the survey will let you check more than 3, but you have to only check 3, because if you check more than 3, we're going to have to throw out your answer, and we wouldn't want to do that. So you can check up to 3. If you really want to only check 1 or 2, that is perfectly fine with us as well. But that's the first question on the survey. The second question is, would you like to join an action team to address any of those priorities? And if so, which one? Now, I wish that we had the capacity to address all of those issues. I would absolutely love that. But realistically, we tend to choose 3 or so top issues to work on in the next 3 years. And yeah, we have to look at our capacity to lead efforts in that amongst our whole community. So by all means, if you're someone who is so passionate about one of these topics and would really like to lead the effort, please let us know on the survey. There is a place to kind of add comments after each of those top 2 questions. So, you know, let us know, like, yes, I would love to really get involved in this. We would certainly provide backbone support here at Public Health. I'd be happy to help support those action teams in any way possible. But we are going to have to kind of get together and look at what we can take on as a community and what is beyond our feasibility at this point. So that is question number 2, is how would you like to be involved? If you can't at this time, that is perfectly fine too. There's an answer option there that says, no thanks, not right now. And then we'll ask you on that survey for follow-up contact information. Your contact info is safe with us. We will just get back to you on our next steps, is our plan with that. All righty. So at this point, yeah, I have another filler slide here for any questions that we could answer, any discussion. You can go ahead and take that survey right now. Maybe you already are, maybe you're already done. I see Julie has her hand up. Julie, please share.
You're muted, Julie.
Oops. I was saying you did a really nice job, Sarah, of explaining this in a nice, concise manner. My question, and you can tell me I should have done my homework before I joined the meeting. Are any of these, I'm guessing they're repeat priority items from the last survey? And if so, are those groups continuing to meet, or I don't understand that process enough to kind of know what happens every 3 years?
That is such an excellent question. Thank you. It kind of leads into our next steps, but let's answer it right here because it's a great question. And I was remiss in not including that. So in our past cycle, which was, let's see, we're 2018. So that was our last cycle. We chose substance use, we chose mental health, and we chose healthy eating and exercise. And certainly our substance use coalition is being addressed. We have our Partnership for Prevention coalition. We've been very fortunate in getting grant funding, both to start up the Partnership for Prevention and now to keep it going. We were just notified a few weeks ago that we have 10 years of funding more for that. So we're so excited. We meet every month to address substance use, and I can tell you a little bit more about that one in the next minute or two with the slides as an example of what we'll do next. But for mental health, we did have a few different coalitions kind of spin off from that topic. We had the Farmer Angel Network that meets still, and that is run by, is it still UW Extension, Jody, that is running that? So that focuses on farmer mental health and farmer suicide rates. And then we also had a group that was meeting in the Sauk Prairie area to address teen suicide. I don't believe they are still meeting, but if anyone in this group knows anything, an update from that group, that was Sauk Prairie Hope. Happy to hear that. It's been really challenging during the pandemic to move forward with these groups. I know a number of you on this call probably attended our kickoff meetings in the beginning of 2020, where we launched Healthy Sauk 2030, and we relaunched Sauk Can, which was our coalition on activity and nutrition. And so those were launched in January. I think Can met one more time in February, and then we got hit in March with COVID-19, and we haven't been able to bring those back yet. But we definitely will be bringing back at least the Sauk County, Healthier Sauk County 2030 coalition. We just have to take a good hard look at our capacity because it's been so rough. But I would say, you know, we definitely need funding, and we need, I would say, more community involvement to really move forward on these priorities in a similar way to what we have done with substance use. Yeah.
Thank you.
Yeah, of course. We'll move into next steps a little bit here. So this was the slide that I shared earlier. So it should look familiar, but that was a whole hour ago about how we work together and communicate to make a community healthier with all of you all in the center. So we assess needs and resources, shared that with you all. We're now in the process this very second of focusing on what's important. We are going to have this recording made available for everyone who couldn't attend today, so feel free to share it with your colleagues and friends and family. And we will leave the survey up for at least another week so that people can continue to vote on what's important to them, so we can get a more accurate feeling from people who couldn't attend this midday session today. Then we move into our action team work. So this would be done, for example, in a coalition. So I'll take the example of the Sauk County Partnership for Prevention working on substance use prevention. So we started meeting in 2017. We did a real deep dive into our data to answer questions like, who is using substances? Where are they using them? What substances are they using? And then we prioritized what groups we wanted to focus on and what drugs. So that group is working on youth use of alcohol and youth use of tobacco, mostly vaping products. And then we go even further, you know, after identifying those areas to what are the risk factors. So for alcohol, we determined that the risk factors were access to alcohol through social sources like parties and access to alcohol through retail sources with our youth buying alcohol illegally at stores or in bars. So that's what that group is working on for alcohol. Similar with tobacco, it's retail access. Where are kids getting vapes? How can we keep them from getting them? And then educating more around perception of harm of vapes, because a lot of people, especially our youth, think it's not so harmful. So we really need to focus on that. So it takes a while. It's nothing we could do in an hour to really dig into these local conditions. But in my experience, that's what really creates effective work in a group, is narrowing down on a local condition that we're going to focus on. Now that coalition is well funded and has staff to, bring it forward. So, we are able to focus on 4 different topic areas, but maybe our action team can just focus on one thing on another priority, and that would be just fine. But we would like to use kind of that method of really honing in, creating an excellent action plan. Then moving back to the wheel here, we'll act on what's important and we'll evaluate those actions. And then, this whole wheel starts again. At least every 3 years, we assess needs and resources, but that actually can happen on a more annual basis working in these groups, because things happen so fast. Like our vaping epidemic, for example, came up, it snuck up on us pretty hard in 2017, where all of a sudden we said, what? The survey is showing that 30% of our kids are using vape products. Like, what? Where did that come from? The year before, it was very few. So yeah, I think that's just an example of how we'll be moving forward to work together and become healthier as a community. So for next steps, I kind of summarize this first point here of how we're going to act on what's important and then evaluate that action plan over time. We will have another community meeting like this one to discuss our health improvement plans and our progress. So we'll report back to you all on what we prioritized and then what was done in those action teams to plan for better health around those issues and get some more feedback on how we're doing there. We will have a report on our health assessment that will include all kinds of technical data. So if you're interested in like how different subpopulations answered our survey, we had some excellent statistical analysis done by Ken at Sauk County Healthcare and also Sarah Reed at the Ho-Chunk Nation Health Department. Really wonderful statistical analysis. I just couldn't include it all today because I wanted us to move through this at a brisk pace, but we will have that. You can check the public health website. You can check the different hospital websites and healthcare partners if you're on the call now and want to put that information in the chat where people can find these community health assessments. Feel free to go ahead and do that. So you should be seeing those this winter, perhaps in early 2022, if not late 2021. And then we are also planning to form a kind of online dashboard to check our progress. This is something that we hope to have ready in 2022 so that we can be accountable to the community. This is what we're working on, and this is the progress we're making on these different measures that we're trying to change. So with that, I have a few acknowledgements here. Just want to send a huge thank you out to all of our partners that helped with this assessment today. The Health and Wellness Steering Committee, you are now 10 years strong. Did you know that? Wow, we got together for the first time for the 2012 health assessment. So that was, I'm guessing, back in 2011. And that group has been meeting now for that long in a very dedicated way. So happy 10-year anniversary to this incredible collaboration. And that includes our area healthcare system. So Reedsburg Area Medical Center, SSM Health, Sauk Prairie Healthcare, plus the Ho-Chunk Nation Department of Health and Sauk County Public Health. So really incredible partnership there. And then all of those entities are also part of the Sauk County Data Council. And I want to thank all the members of that council because you all worked really hard for us. With us in this 1 year anniversary time frame. So thank you. You really took on this community health assessment and did an outstanding job of really making it accessible and as equitable as possible. In addition to the steering committee members that I just mentioned, this group includes representation from village and city governments, schools, Sauk County Development Corporation, law enforcement, and more. So thank you to all of you, and also thanks to Uli Grunberg of the Grunberg Institute for these awesome photos of Sauk County. So I will stay on and answer any questions that you all have for as long as you want to chat. You can unmute. We'll stop our recording in just a moment. But before I do that, are there any last minute things in the chat or people who want to talk? And I see Ken has raised his hand.
I did, Sarah. I just wanted to invite anyone from the Sauk Prairie, River Valley, Lodi, and Wisconsin Heights school districts. We kind of cross over the county boundaries to feel free to contact me or Brenda Humbrock if they want to provide input. As Sarah said, our community health needs assessment is due at the end of the year, and then following that immediately after is a community health improvement plan. And we would love input, and we will reach out to as many people as we can who are in our particular area. So, and I'm pretty sure that the same goes with Tammy at Reedsburg for her area, and Dave for the Baraboo area as well. I think he had to jump off, but so
Yep,
get involved.
absolutely.
All your healthcare providers also have to do this, and it's a good thing. It's not only is it required by law, but it's also the right thing to do.
Thanks, Ken. And I heard Tammy say absolutely. So contact Tammy if you're in the Reedsburg area, or Dave Climers in Baraboo. You can always contact me for different people's contact information, or just let me know how you'd like to be involved. I'll be your main contact at the health department, but can also put you in touch with others in this area. Anything in the chat, Siobhan, that we should check in on?
We have a couple of congratulations messages in the chat for our anniversaries of our committees. We did also have another question asking about accessing this data for our surrounding counties. So in the chat, I did put the link for the county health rankings and also for the census data for some of the comparable datas. And I see Tammy put in the link for the Reedsburg Community Health Needs Assessment. And again, as Sarah said, if anyone needs contact information, links, additional information, I put in Sarah's email to contact us as well.
Wonderful. Well, thank you all so much. We are wrapping up 4 minutes early, so right on time. But again, if you would like to stay and chat, we will keep the room open for you. So thank you all so much for your time and attention. We really appreciate you, and we look forward to improving health in Sauk County with you. Bye-bye.